Most people think that surgery is the final answer for chronic joint pain, the so-called last resort. But what if it was never the solution in the first place? Hi, I'm Dr. Roy Picard, DC with Michigan Integrative Health. The medical team and I see patients all the time who've had back surgery, knee replacements, hip procedures, and are still in pain. They did everything right, they followed every doctor's order, and somehow ended up worse than before. So what went wrong? The truth is, the problem isn't always the surgeon or even the diagnosis. It's having an understanding of the fundamental components that cause the diagnosis. Most surgical decisions are based on imaging. X-rays, well, they show structure, bone alignment, spacing. MRIs show inflammation, degeneration, tears, but neither of these tests measures joint stability. They don't test the degree of joint stability. They don't test whether your body compensates when stressed. And they definitely don't test real-time stability. So when someone walks into surgery without the data, the entire process is built on assumption, not evidence. That's why we do something completely different before we accept anyone for care. We run real-time joint stability testing. Here's what that looks like. We assess how your joint responds under load, in motion, strength, and pain. Without any chiropractic adjustments or physical joint manipulations, we can put the affected joint into a specific position under a certain amount of tension and then immediately retest the joint under load in motion, strength, and pain. If your motion improves, your strength increases, or your pain decreases during the test, that tells us that your tissue can heal. In fact, over 85% of the patients we test, regardless of whether they have already had surgery or not, show improvement on day one. That's not theory, that's data. And it tells us whether we can help or not. Let me give you a real-world example. Marge came to us after having a failed back surgery. She was still in daily pain. She was no better off after the surgery for her spinal stenosis. She couldn't sleep, lay down. She couldn't hardly stand for more than a couple minutes without having to sit. She was always in pain. She was told that there was nothing else that could be done. The imaging report showed that there was nothing wrong. Marge was forced to look outside of the traditional medical approach, and after receiving our joint stability testing, we were able to define the instability in her low back and pelvis. She noticed the change during her assessment immediately. She received our care and weeks later got her life back. The surgery, although performed correctly, hadn't addressed the instability because it was never tested. And please understand, this isn't about blaming the system, it's about upgrading it. Structural imaging is definitely helpful, but it's only one piece of the puzzle. If you want to stop chasing symptoms, you have to test the system that controls them, and that's joint stability. You wouldn't build a house on a foundation that's never been pressure tested. So why would anyone rebuild a joint that way? If you've done everything right and you're still in pain, you may not be broken. You just haven't been tested the right way.